Thank you, and good afternoon, everybody. I hope I don't put you to sleep, being the last speaker. But yeah, so I'm here to talk about maternal care for women impacted by migration from the community perspective. If I can have the next slide, please. Oh, sorry, I'm supposed to be doing that. Okay, and these are my disclosures. Is that okay? I wanted, hopefully by the end of the slides, for us to explore the challenges that migrant women face, to understand the community perspective in supporting these women, and also highlight the best practices and community-driven solutions that we use here in the UK. Just to give a bit of background and put things in context, I thought we'd revisit the global trends. Over 281 million people, which is 3.6% of the global population, were international migrants, and these are figures as of 2020. Half of that population are women. Over 35 million are refugees and asylum seekers, many of whom are women of childbearing age. A significant number migrate during their reproductive years, obviously increasing the need for maternal health care services. These trends, I think someone mentioned earlier, is due to rising conflicts, climate change, and economic situations and opportunities abroad, which is why people travel or migrate. This obviously leads to disrupted healthcare and displacement of, now I'm rabbiting on. So displacement often leads to disrupted access to healthcare. And why is this important? Okay, because that then leads to higher maternity mortality rates. I'm probably giving you, information that we already know, but it's worth bringing that back to our memories. We have these women have limited access to antenatal care when they migrate or they're displaced and they come to other countries. It increases their preterm birth rates. It also causes a strain on healthcare systems, and I'd like to emphasize here that it's not necessarily people migrating to other countries. Sometimes migration is even within countries, and people are moving from rural areas to urban areas, and that still puts a burden on the healthcare system. And of course, it has huge psychological impact on these women. All the other speakers have touched on this, so I won't go too much into it, but there are legal and policy barriers. There are economic constraints, meaning most of these people don't have access to money. If it's in the UK, they're not allowed to work. They, do not qualify for any recourse to public funds. So that means all the money they cannot afford, medical care, for example, or anything to do with pregnancy, which is, as somebody said, that costs someone about £2,000, which is ridiculous if you've got no access to money. Cultural and language barriers, we find that this is consistent, never mind where you are. That includes religion. We have different ways of giving birth, and getting that through to some of the women can sometimes cause, a lot of barriers. Fear of stigma and discrimination, particularly in the HIV sector, can cause people not to want to access care. So what do we do as community organisation? What's our role? We provide emotional support. It provides a space for people to connect socially, which then in turn has mental health benefits, and it provides these women with a lot of power, empowerment and advocacy skills and tools to be able to advocate for themselves. We provide a lot of information dissemination, resources, health education, even just basic knowledge of how to navigate the system. A lot of the charities or community organizations provide practical support in terms of actually showing people how to get to one place to another. We provide language and cultural mediation. A lot of the charities have people who have different language skills, understand the cultural nuances a bit better, so therefore it's easier to have those kinds of conversations with these women. And also then that way you're building trust, because they know that it's somebody that understands where they're coming from. We provide resources and sometimes intervene in crises. The previous speaker mentioned food chain. A lot of these people don't have access, so you're able to then make those referrals at a very short term without filling out too much paperwork. Nobody asks you where you've come from and all of that kind of thing. These are examples of community-led initiatives. What I should have said earlier was what qualifies me to speak on behalf of these women is because I'm a migrant. I came here as a migrant and accessed maternal health care, but also in the context of having lived experience of HIV for the last 28 years, I think. So it's something I know, it's something that I provide a lot of support with, and that's where most of my work has been embedded. I'm co-director of 4M Mentor Mothers Network CIC, thank you, I see we were up there. And we provide mentoring and training for women living with HIV going through the perinatal journey. But we also collaborate with a lot of the other organizations. So if you think about doula programs for people who prefer, to have that kind of intervention, that's something that we can help navigate. So I thought I'd just put there some of the examples. These are some of the quotes from the women that we've managed to support. Fungai was saying I was referred to Sussex Beacon, who supported me with a pre-loved bottle sterilization kit and formula. So that's very practical kind of support. We have to acknowledge that some of our wonderful babies are born with additional needs, like my eldest. We had huge help from the family fund from 2014 until she turned 18. So that just gives you an idea of how much scope that community organizations provide some support. This particular lady didn't want to be identified, so we got the quote from the mentor mother who actually provided support to her. There's two different ladies. A lady was given a used stroller after her child had outgrown the pushchair, and she was so grateful she didn't have the funds to buy a new one due to lack of recourse to public funds. Another one was assisted with £60 during winter because she'd run out of gas. And those are the kinds of things that people deal with every single day. So the flip side to the kinds of services that we provide are obviously quite obvious. There's improved maternal and child health outcomes, which I think is what we're all trying to achieve at the end of the day. There's enhanced trust and increased confidence in engagement with healthcare services. There's a reduction of social isolation and mental health challenges. And for the women themselves, there's improved skills and knowledge base. So, what are the strategies to enhance community support? And I thought I'd narrow them down to 3. We need to invest in culturally competent healthcare training. I think that's lacking quite a lot in our healthcare system, and that's no dig at the healthcare system, it's just the way things are at the moment. We need to strengthen partnerships between healthcare systems and community organizations. I've seen lots of links where we can be of really great support, but all of that needs funding for grassroots organisations to support these migrant women, and that needs to be long-term and sustainable so that we can continue this kind of work. And then maybe just this call to action. Support community-led approaches to maternal care through funding long-term sustainable programs, which is what I was saying. We need to advocate for inclusive healthcare policies and practices that are culturally appropriate. I think it's, if I can expand on this, I know we're all referring to writing stuff in or providing resources in different languages. I remember having to speak to one of the groups that I went to, and someone pointed out that you can have the resources in writing, and the fact that I can speak Swahili doesn't necessarily mean I can read it. And this is where community organizations come into play, because then I can have the conversation on a one-to-one and still make sure that the lady then is able to understand that information. And then the third one is to collaborate across sectors to ensure equitable access to care and involve them in research and delivery of services with these specific communities that we work with. I think one of the things we always advocate for is that research should have the meaningful involvement of migrant women or people with a lived experience, because then that informs, you know, whatever the outcome is, and then it's worth doing at the end of the day. There's no point in producing stuff that people aren't going to use at the end of the day. Those are just the references. And that's to acknowledge my 4M Mentor Mothers Network, who informed my presentation. Thank you.